Science of safety is a new way of thinking about child safety and collaboration with community partners and families that we work with. Science of safety is different from other child welfare approaches because it involves collaboration with families that allows them to be partners in finding ways to keep their kids safe. It's based on the idea that most families can keep their own children safe most of the time without our help. So this is a basic science of safety mapping where we start with what's working well and it involves a conversation with the family that we're working with. So we try to elicit answers from them that would help us understand what's working well now, insofar as how we might be able to mitigate the worries that we agree we have with the family, which then ends with a discussion around what needs to happen to make sure that what's working well is able to counterbalance what the worries are and what needs to happen for the future in order to keep the kids and the family safe. And we separate out the complicating factors, which might include family members' mental health issues or intergenerational poverty, which aren't exactly risks or threats to the children, but they're complicating factors that may impact the threats to the child. Finally, at the bottom we have a safety scale where we would try to find agreement on where in the scale of 1 to 10 the child's safety is. And if there's agreement that the child's safety is at a scale of 5, we would have a discussion on what it would take, what we could do as a team to help move it from a 5 to a 6 or a 7. So science of safety includes some very helpful tools to engage children, including the 3 houses and wizards and fairies, which helps workers to explore kids' worries and wishes and dreams, and helps the kids help us understand what they need to feel safe in the home that they live in. So using scaling as part of the science of safety framework, the family was able to identify that several years ago they weren't doing as well as they'd like to be doing. They were able to say that currently they were at a 6 or a 7 and that their potential was a 9.5. That led to a conversation about what they needed in order to reach their potential of 9.5, which we were able to engage with community partners in order to address some of the complicating factors that were really what was holding them back from reaching their potential. Science of safety is definitely more work at the beginning of the time that we're working with a family. That's because it's much more in depth, it's much more genuine, it involves building relationships and cooperation with families. But once we are able to accomplish that goal, the rest of our work with the family can be so much easier. I feel as a family service worker that I am more focused in the work that I'm doing. I feel like I understand where we should be going with the family. It helps ground me, and it's making my job much more enjoyable because I feel like we're accomplishing more in terms of helping the families that we work with. We're thinking differently.